Hey, Dr. Coleman, can you explain precipitated withdrawal?
Sure. Precipitated withdrawal is a situation that happens when people start using Suboxone or buprenorphine when they've been using a full agonist like heroin or methadone or any other kind of opioid. And it's all to do with the fact that buprenorphine or Suboxone only occupies the receptors partially. It turns the switch on partially, so we call it a partial agonist. And I use the number 70%. I'm not sure how accurate it is, but it's a good way of thinking about it, that buprenorphine turns the switch on about 70%. It lasts a long time and it doesn't give you the dopamine spike, so it's a good treatment, but getting onto it can be really quite tricky. And the way it works in a nutshell is that if you're on a 100% agonist with like heroin or fentanyl, and then you immediately switch to a 70% agonist, then you're going to feel pretty horrible because you're going to go into 30% withdrawal, if that makes sense. And that's kind of what happens because the buprenorphine sucks onto the receptors so strongly that it displaces the full agonist, the heroin or the fentanyl, but only turns the switch on 70%. So that's kind of the best way to think of it. The way to resolve that is to wait for your fentanyl or your heroin level to get down to maybe 60%, and then the 70% feels good. You feel better, so it avoids the precipitated withdrawal. But a lot of people have real trouble getting down to 60% because they feel so horrible because of their withdrawal, and so they push it and then they end up with this precipitated withdrawal. So when we're treating patients, we do two things. We wait for their withdrawal to get pretty bad as they can stand it. We often use some comfort meds in order to feel better while their opioid they've been using goes down. And then we only use a small dose of Suboxone or buprenorphine so that we're not displacing all of the other agonists, the full agonist at the same time. And so the new buprenorphine's filling up the empty receptors. It's a complicated sort of situation, but it makes sense logically. I hope that helps you understand it. It is able to be, avoided almost all the time. Every now and then some people are different and they still get a little bit, but most of the time we're able to, avoid it completely.